Hi, I'm Xavier, active duty medic. Today, we're going to show you how to pack and bandage an axillary junctional wound. This is done during the tactical field care phase where these life-saving treatments can be safely provided. First, consider body substance isolation. You're going to want to lift the arm to expose the injury and assess the bleeding source. Clothing may need to be cut away to properly expose the injury. The best position to treat the casualty is the seated position. If the casualty cannot be treated in the seated position, you will need to sit the casualty up as much as possible to apply the elastic bandage. If possible, apply direct pressure to the source of the most active bleeding, using the casualty's joint first aid kit or JFAC. Remove the hemostatic gauze from its sterile package. If hemostatic gauze or a dressing is not available, use a clean, dry cloth material. Next, extend the casualty's arm at a 90-degree angle by placing it on your shoulder to maintain elevation of the arm while proceeding through the remaining steps. Now, pack the axillary wound tightly with hemostatic gauze until the wound cavity is filled, finishing the packing within 90 seconds. More than one gauze may be required to stop the blood flow. And remember, if a penetrating object is lodged into the casualty's body, bandage it in place. Do not remove the object. Ensure the gauze extends 1 to 2 inches above the skin. If the gauze does not extend 1 to 2 inches above the skin, place additional gauze. Then, hold pressure for a minimum of 3 minutes. Now, reassess to ensure bleeding has been controlled while maintaining pressure. If bleeding has not been controlled after packed with a hemostatic dressing, remove the prior packing material and repack the wound. If packed with gauze, apply additional gauze and pressure for 3 minutes until bleeding has stopped. While maintaining pressure on the dressing or gauze, wrap the pressure or elastic bandage around the injured shoulder twice, ensuring the gauze underneath is completely covered. If using an elastic bandage without a closure bar, leave a tail on the posterior side of the casualty. Then, wrap the elastic bandage across, back, and under the opposite armpit, anchoring around the opposite shoulder in a figure 8 pattern. Depending on the bandage used, secure with the closure bar or tie the tails of the elastic bandage together with a non-slip knot. Next, secure pressure or elastic bandage tails and knot using 3-inch tape, wrapping the tape a minimum of 1 to 1.5 times around the knot. Now, swap the upper arm on the injured side to the chest using a cravat. Continue to assess the wound for further bleeding. Lastly, document all findings and treatments on a DD Form 1380 TC3 casualty card and attach it to the casualty.